So lower risk MDS includes a large group of patients that have SF3B1 mutation. And this is sort of inherited a little bit from the group of MDS with ring sideroblasts in the prior classification. But I think current concepts have shown that we can more precisely define a lower risk disease that by the SF3B1. Now, this is a little bit complicated because some therapies have been approved based on ring sideroblastic MDS, but the idea is that perhaps these therapies may be better targeted to the group of patients that have SF3B1 mutation that we know have particularly favorable prognosis within the group, the larger group of MDS with ring sideroblasts. So the idea is to, again, define this group more precisely by its genetics. And I think that will, again, help give more precise risk-adapted therapy. Aside from patients that have wild-type SF3B1, I think this is a more difficult group to define. I think we have prognostic. I think the ultimate in risk-adapted therapy is using prognostic schemes like the new IPSS-M scheme, which incorporates mutations. I think that's really to define the risk of the disease, which is a little bit different from classification. Right now, we sort of classify cases in a group of MDS-NOS in the ICC, and that can be qualified by the number of lineages that are dysplastic, by, for example, the WHO uses fibrosis or hypocellularity. These are all features that I think can color the risk of disease, but I think to most accurately identify the risk is to use a tool that measures the risk of prognosis, like the IPSS-M, not necessarily the specific disease class according to the ICC.